Alrighty, so doing a primary assessment here. First things first, you're gonna check for any severe bleeding because you want to get that addressed first. Next, you kind of ask the patient, just see how they're doing, check their level of responsiveness. How's it going, sir?
My hip's really bad.
Your hip's hurting?
Yeah.
Okay. You want to scale the level of consciousness based on like alert, verbal, or painful and responsive, whether or not they're like really responsive to like you talking, whether or not they're only responsive to like say like, oh hey, what's going on? Then they respond, or respond to pain, like when you touch them and it hurts, or if they're just unresponsive, like they're not even like talking back to you or saying nothing. Then you're gonna go through ABCs, check the airway, make sure the airway isn't blocked, checking for breathing, looking to make sure the chest is rising up and down, checking circulation. Here by the carotid artery right here. Next, so we're gonna pretend like you're unconscious for a second. So you're gonna wanna look inside, check the airway, make sure nothing's blocked. You're gonna listen for breathing. Okay, and also while listening, checking circulation. Okay. Now this is for conscious. I'm gonna check again for respirations, hearing the quality of breathing, making sure it's not raspy or it's very like shallow. Listening, feeling for it. Also, looking for the fall, the rise and fall of the patient's abdomen while they're breathing. Next, you're going to listen for the sounds as he inhales and exhales. Next, you're going to count the number of times a patient breathes in 15 seconds, then multiply by 4. So, count here. 1,000, 10,000. 15,000. I would say multiply that by 4, 15 breaths. No, 16 breaths, my bad. Next, you're going to place 2 fingers on the major artery, right here, major artery, or if it's radial, right here. And then if it was a baby, it'd be more like right here. Then you're gonna check the pulse rate. So take right here, feel right here, pulse. Okay, now I'm gonna start counting 15 seconds. 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000, 11, 1,000, 12, 1,000, 13, 1,000, 14, 1,000, 15, 1,000. Then multiply that by 4, get 76 beats per minute. Next, I'm going to check the skin, looking to make sure it's not pale, checking if it's like moist or if it's very dry. I'm also going to check the fingernails. I'm going to squeeze the finger, and it should return to color within 1 to 2 seconds to ensure that there's sufficient blood flow. And that is all for part 1.